Chapter 8, Blood, Blood-Forming Organs, and the Immune Mechanism. Functions of the blood and immune system. The blood, lymphatic, and immune systems are three integrated systems that help the body maintain homeostasis, which means at a steady state. The functions of the blood are 1. To provide transportation of gases, which is your oxygen and carbon dioxide, hormones, nutrients, salts, and cells that defend the body. 2. To regulate the body's fluid and electrolyte balance, acid-base balance, and body temperature. 3. To protect the body from infection. And 4. To protect the body from loss of blood through the action of clotting. The functions of the lymphatic system. The lymphatic system is responsible for cleaning the cellular environment, returning proteins and tissue fluids to the blood as a means of drainage. It's providing a pathway for the absorption of fats and fat-soluble vitamins into the bloodstream and defending the body against disease. The functions of the immune system is responsible for defending the body against disease via either the immune response. The combining form of immuno means safety or protection. Relationship of the lymphatic vessels to the circulatory system. The blood and lymph flow through separate but interdependent channels. Both systems are composed of vessels and the liquids that flow through them. The immune system, a complex system of levels of protection for the body, includes both blood and lymphatic cells. Hematic system. Blood and vessels. Hematopoiesis is the process of the formation of blood. A blood cell originates from a single type of cell called hematopoietic stem cell or hemocytoblast. And there are word parts that go along with this. So with your word parts, you've got hemato equals blood, poiesis equals formation, hemo is also blood, cyto is cell, and blast is embryonic or immature. Note that the differentiation from the HSC to the different types of blood cells. Blood composition. The three types of blood cells are red blood cells, which are called erythrocytes, white blood cells are called leukocytes, and clotting cells called thrombocytes or platelets. To have an idea of the relative numbers, in a milliliter of blood, there are 4.2 to 5.8 million red blood cells, 5,000 to 9,000 white blood cells, and 250,000 to 400,000 thrombocytes. Blood itself accounts for about 8% of the total body volume, and the average volume of blood is about 10.5 pints or 5 liters. The liquid tissue of blood is composed of a solid portion that is made up of the cells and a liquid portion called the plasma. The cells make up approximately 45% of the total blood volume, and plasma is the other 55%. These numbers vary slightly depending on an individual's sex, but are important in the measurement of hematocrit, a test that will be discussed in the diagnostic terms section. And your word parts. Erythro is red, cyte is cell, leuko is white, and thrombo is either clotting or clot. Aside from the function of transporting oxygen and carbon dioxide throughout the body, the blood must carry a protein iron pigment called hemoglobin. Red blood cells are formed in the bone marrow as a result of stimulation by a hormone in the kidneys called erythropoietin. The life cycle of red blood cells is about 4 months or 120 days, after which time it decomposes into hemosiderin, and that is an iron pigment resulting from hemolysis. Aside from the hemosiderin, bilirubin is also a byproduct of the decomposition. The iron is stored in the liver for recycling, and the bile pigments are excreted by the liver. The morphology of blood cells is important. Morpho equals shape. Normal blood cells have a bioconcave, disc-like shape, which moves easily throughout the vessels. In some disorders, such as sickle cell anemia, the shape of the cell is changed, which results in dysfunction and disease. And over on your left side again, we've got your word parts. Hemo or hemato is blood. Erythro again is red. Cyte is cell. Globin is protein. Mylo is bone marrow. Siderin is iron substance. Poietin is forming substance. Lysis, breaking down. Morpho is shape or form. And logy is a study of. Now be careful. These are all abbreviations for hemoglobin. Your HGB, HB, H lowercase b, and HG are all abbreviations for hemoglobin. And H little g is abbreviation for mercury. The one that you will mostly see is the HGB, the first one. Okay, the components of blood and white blood cells. Leukocytes in general protect the body from invasion by pathogens. There are two main types of these white blood cells. The first type is granulocytes, which can also be called polymorphonucleocytes, are named for the small grains within the cytoplasm and the mitylobed of nuclei. The two names are used interchangeably, and you should be familiar with both. There are three types of granulocytes. You have eosinophils, which are cells that absorb a rosy-colored acidic dye, which causes them to have a reddish color. An increase in eosinophils is usually the body's response to defending itself against allergens. Neutrophils are cells that are neither acidic nor alkaline, and they stain a lavender or purplish color. An increase in neutrophils is normal when the body is combating bacteria in pyogenic infections. The cells perform the function of phagocytosis, where they consume the enemies and remove the debris from the battlefields. Basophils are cells that absorb a basic dye and stain a bluish color. Especially effective in combating parasites, they release histamine, which is a substance that initiates an inflammatory response, and heparin, an anticoagulant, both of which are instrumental in healing damaged tissue. Your word parts. Leuko is white. Cyte equals cell. So a leukocyte would be white cell. Granulo is little grain. A is no, not, or without. Poly equals many. Morpho is shape and form. Nucleo is nucleus. Isono is rosy colored. Phil is attraction. Neutro is neutral. Phago is either eat or swallow. And baso equals base. Now here's a special note. Granulocytes are also known as polymorphonucleocytes, abbreviated PMNS or polys. However, one type of granulocyte, the neutrophil, is also commonly referred to as polymorph, the PMN poly, because it has the greatest degree of nucleopolymorphism, and in addition to being the most common type of leukocyte. Okay, components of the blood and white cells, slide continuation. Granulocytes are the second type of leukocyte. Notice that there is an A as being added, denoting the absence of a small grains in the appearance of these cells. They too have another name, mononuclear leukocytes because the nuclei have only one nucleus. Although these cells originate in the bone marrow, they mature only after entering the lymphatic system. There are two types, monocytes and lymphocytes. Monocytes are named for their single large nucleus. These cells are transformed into cells called macrophages, which eat pathogens and are called out for severe infections. Lymphocytes are cells that are important in the immune response, meaning that they recognize or remember dangerous foreign substances and manufacture a substance to neutralize them. The foreign substances are termed antigens, and the neutralizing substances are called antibodies. Then we've got your word parts. A again would be no, not, and without. Granulo is little grain. Cyte is cell. Mono equals one. Nucleo is nucleus. R pertaining to. Macro equals large. Leuko equals white. And lympho is lymph. Be careful to don't confuse cyto meaning cell with cysto, which means bladder or sac. Components of blood and thrombocytes, also known as platelets. The thrombocytes or platelets have a round or oval shape, and the name platelet comes from their appearance as little plates. These cells aid in the coagulation, which is clotting of the blood, which is the process of changing a liquid to a solid. The process of coagulation begins with agglutination, which is the clumping of the cells. The cells release a substance called factor X, which is the presence of calcium, reacts with the blood protein prothrombin. Prothrombin then forms thrombin. Thrombin converts to another blood protein called fibrinogen. Fibrinogen is then converted to fibrin, which eventually forms a mesh-like fibrin clot. Homeostasis, or the control of blood flow, is then achieved. And then over there we've got our word parts. You got your thrombo equals clot or clotting. You got cyte is cell. Pro is before. Thrombin is clotting substance. Fibro is fiber. Gen is producing. Hemo is blood. And stasis is stopping or controlling. And again, be careful. Don't confuse homeostasis, meaning control of blood, with homeostasis, meaning a steady state. Okay, here's your first review question. Thrombocytes, are they A, are clotting cells, B, are white blood cells, C, protects the body against disease, and D, carry hemoglobin? So if you've got thrombo, which means clotting or clot, it would be A, are clotting cells. Composition of blood and plasma. Plasma is the liquid portion of blood, and it is composed of water, inorganic substances such as calcium, potassium, and sodium. Then you got organic substances such as glucose, amino acids, fats, cholesterol, and hormones. Your waste products, urea, uric acid, ammonia, and creatinine. And then your plasma proteins is your serum albumin, serum globulin, and clotting proteins such as fibrinogen and prothrombin. Serum is a plasma minus the clotting proteins, fibrinogen, and prothrombin. The serology is the branch of laboratory medicine for evidence of infection by evaluating antigen-antibody reactions in vitro, which is in living tissue. And your word parts, plasma. Plasma O is plasma, and sero is serum. Then you got your blood groups. Human blood is divided into 4 major groups. You have A, B, AB, and O. The differences are due to the antigens present on the surface of a blood cell. Remember that antigens are substances that produce an immune reaction by their being perceived as a foreign to the body. Because of this recognition as foreign, the body produces substances called antibodies to neutralize the invader. In blood, the antigens are called agglutinogens because they are substances that produce gen, clumpy substances, which is a gluten, and the antibodies are called agglutinins. Type A blood has A antigen. Type B has type B antigen. Type AB has type A and B antigens. And type O has neither A or B antigens. So if a type A individual is transfused with type B blood, the blood will agglutinate because type B blood is perceived as foreign. However, the same type A individual could be transfused with a type O blood because it has neither type A nor B type antigens. Type O blood, therefore, is the universal donor because it has no antigens that will cause a reaction with any of the blood types. Type AB, however, is referred to as the universal recipient because it has both type A and type B antigens. The Rh factor is another antigen. It is important in pregnancy because a mother who is Rh negative can develop antibodies to the Rh positive fetus in the first pregnancy and cause hemolysis of fetal blood in the subsequent pregnancies. And then you have your word parts where you say we got anti is against, gen is producing, agglutinin is a clumping, N equals substance, hemo is blood, and lytic is pertaining to breaking down. Okay. Review question. The universal donor of blood group is what? A type A, B type B, C type AB, or D type O? And your universal donor in the blue group would be D type O because it neither has antigen A nor antigen B. The immune system is composed of organs, tissues, cells, and chemical messengers that interact with the body from external invaders and its own internally altered cells. The cytokines are the chemical messengers that are secreted by the cells of the immune system that are direct immune cellular interaction. Lymphocytes secrete lymphokines, and monocytes and macrophages secrete monokines. The interleukins are a type of cytokine that sends messages between leukocytes to direct protect actions. Nonspecific immunity refers to the various ways that the body protects itself from the many types of pathogens without having to recognize them. The level of defense provided by the immune system are divided into a first line, which is nonspecific immunity, a second line, which is another type of nonspecific immunity, and a third line, which is a specific type of immunity. And as you see, there are the word parts. You've got immuno, cyto equals cell, kin equals movement, lymph is lymph, mono is one, inter equals between, and leukin is white substance. So if you look at the first word of cytokines and you look at the breakdown of it, you've got cyto is cell and kin is movement. So it would be cell movement. The first line of defense includes 3 different methods of warding off pathogens. Without having to recognize them, they are mechanical, the barrier of the intact skin, the sticky mucus on mucous membranes. The physical is coughing, sneezing, vomiting, or diarrhea. And then the chemical is tears, saliva, or perspiration. With the second line of defense, it comes into play if the pathogens make it past the first line of defense. These would include phagocytosis, which is the neutrophils and monocytes. Inflammation is heat, swelling, redness, and pain. Pyrexia is fever. Protective proteins with interferon disrupts the viral replication. Complement proteins are inactive forms that are activated in the presence of bacteria to destroy an organism. The natural killer cells is a specific type of lymphocyte that acts nonspecifically to kill cells infected by certain viruses and cancer cells. The word parts: phago is eat or swallow. Cyto is cell. Osis is abnormal condition. Pyro is fever or fire. And ixia is condition. Third line of defense. Specific immunity means that the immune response is tailored for a particular organism. The antibodies formed for particular antigens are termed immunoglobulins. The recognition of this pathogen can be genetically determined or acquired. If genetically determined, individuals inherit the ability to resist certain diseases because of their species, race, sex, or individual genetics. Acquired forms of immunity are either active or passive, which means active acquired immunity. That means natural immunity is the development of memory cells to protect an individual from a second exposure. Because individuals were exposed to chickenpox and came down with it, they are then immune to another round. Artificial immunity, such as vaccinations, immunizations, are used as a weakened form to enable the body to form antibodies. Passive acquired immunity. Naturally passive immunity is the passage of antibodies through the placenta or breast milk. Artificial passive immunity is the use of immunoglobulins harvested from a donor who develop immunity against specific antigens. A review question. Sneezing, coughing, and vomiting are examples of which level of immune defense? A, first level. B, second level. C is third level. And D is fourth level. It would be A, the first level, because this is a physical means of defense. Terms related to nutritional anemias. B12 deficiency is an insufficient blood level of cobalamin, also called vitamin B12, which is necessary for mature RBCs. It may be caused by inadequate diet intake or by the absence of intrinsic factors, a substance necessary for B12 absorption. Folate deficiency is anemia that results from the lack of folate from dietary, drug-induced, congenital, or other causes. Pernicious anemia is progressive anemia that results from a lack of intrinsic factor essential for the absorption of vitamin B12. Cytopenia is deficiency of iron in the blood. This may be due to chronic blood loss, inadequate iron intake, or unspecified causes. It is a type of iron deficiency anemia. Your word parts. You've got an, again, is no, not, and without. Anemia is a blood condition. O is iron, or penia is deficiency. Hemolytic anemias are caused by the destruction of red blood cells. If the type is an autoimmune acquired hemolytic anemia, the patient's own immune system is responsible for the destruction of the RBCs, also known as red blood cells. If it is non-autoimmune acquired hemolytic anemia, it may be drug-induced or caused by an infectious agent. Autoimmune acquired hemolytic anemia is caused by the body's destruction of its own RBCs by serum antibodies. Your non-autoimmune acquired hemolytic anemia may be drug-induced or may be caused by an infectious disease in which the RBCs are destroyed. Glucose 6-phosphate dehydrogenase deficiency is an inherited enzyme deficiency that causes hemolytic anemia. The hemoglobinopathies is a general term for genetic defects of hemoglobin. Thalassemias are the group of inherited disorders of people of Mediterranean, African, and South Asian descent, in which the anemia is a result of a decrease in the synthesis of hemoglobin. This results is decreased production and increased destruction of your RBCs. The word parts. Hemo is blood. Lytic pertaining to breaking down. Auto equals self. Immune is safety and protection. Globino is protein. Pathy is the disease process. Sphero is sphere. Cytosis is condition of abnormal increase in cells. Thalasso is C, and anemia is blood condition. All right, terms related to hemolytic anemias. Sickle cell trait is a condition where an individual has one gene for normal hemoglobin and one for sickle hemoglobin. Those who have the trait do not exhibit symptoms of sickle cell disease. Sickle cell anemia is an inherited anemia characterized by crescent-shaped RBCs. This abnormality is morphology causes the RBCs to block small diameter capillaries, thereby decreasing the oxygen supply to the cells. A sickle cell crisis is an acute painful exacerbation of sickle cell anemia. Terms related to aplastic and other anemias and other bone marrow failure syndromes. Acute post-hemorrhagic anemia is a red blood cell deficiency caused by blood loss. Aplastic anemia is a suppression of a bone marrow function leading to a reduction in RBC production. Usually idiopathic, this is often fatal disorder, may be caused by hepatitis, radiation, or cytotoxic agents. It is also referred to as hypoplastic anemia. The erythroblastocytopenia is a deficiency of immature red blood cells that is significant because it indicates a future lack of mature blood cells. Myelopathosis is a wasting of bone marrow, usually with replacement by cancer cells. And pancytopenia is a deficiency of all blood cells that is caused by dysfunctional stem cells. The word parts. You've got post equals after. Hemo is blood. Rhagic is pertaining to bursting forth. No, not without. Plasto is formation. Ic pertaining to. Erythro is red. Blasto is embryonic or immature. Penia, condition of deficiency. Myelo is bone marrow. Pathysis is wasting. Pan is all. And cyto equals cell. Okay, you've got disseminated intravascular coagulopathy, DIC, and it's a disorder of clotting mechanisms that result in bleeding at scattered sites in the body. Hemophilia is a group of inherited bleeding disorders characterized by deficiency of one of the factors necessary for the coagulation of blood. The suffix philia means a tendency toward or an attraction, and in this case, it is tendency to bleed. Purpura is a bleeding disorder that's characterized by hemorrhage into the tissues. Purpura comes from the Latin word for purple. Thrombocytopenia is a deficiency of platelets, which are known as thrombocytes, that causes the inability of the blood to clot. This is most common cause of bleeding disorders. Thrombopilia is an increase in the body's tendency to form clots. Your word parts. Intra equals within. Vascular is vessel. R pertaining to. Coagulo is clotting. Pathy is disease process. Hemo is blood. Philia is condition of attraction. Purpura is purple. A is noun ending. Thrombo is clot or clotting. Cyto equals cell. And penia is deficiency. Terms related to other disorders of blood and blood-forming organs. Erythrocytosis is an excessive number of red blood cells in the blood. Methemoglobinemia is an abnormal condition in which red blood cells are unable to carry hemoglobin. This may be heredity or acquired. The myelofibrosis is an abnormal condition of fibrous tissue development in the bone marrow due to chromosomal abnormalities. Plasmacytosis is an excessive plasma cells in the blood. The word parts. Erythro is red. Cytosis is the condition of abnormal increase of cells. Meta is change. Hemo is blood. Globin is protein. Emia is blood condition. Mylio is bone marrow. Fibro is fiber. Osis, abnormal condition. And plasmo equals plasma. Terms related to coagulation defects, purpura, and other hemorrhagic conditions. Leukopenia is an abnormal decrease in white blood cells. Specifically, these would be neutropenias, eosinopenia, monocytopenia, and lymphocytopenia. Note that the bandemia is an increase of immature neutrophils bands that may indicate an infection. You may also see them in the term for abnormal decrease of WBCs, which equals white blood cells, written as leukocytopenia. Given the functions of the white blood cells, why would a deficiency of white blood cells be a problem? That would be less protection from pathogens. Word parts is leuco is white, penia is deficiency, isano is rosy colored, mono equals 1, cyto is cell, lympho is lympho, neutro is neutral, band O is bands, and emia is blood condition. Okay, leukocytosis is an abnormal increase of white blood cells. The suffix cytosis means abnormal increase of cells. Abnormal increase in each type of granulocyte are termed eosinophilia, basophilia, and neutrophilia. An abnormal increase of each type of the granulocytes is termed lymphocytosis or monocytosis. The word parts, leuco equals white, cytosis is abnormal increase of cells, mono equals 1, baso equals base, philia is attraction, eosinio is rosy colored, neutro is neutral, and lympho is lymph. Asplenia is the absence of the spleen, either congenital or acquired, as a result of the surgical removal. Hypersplenism is an increased function of the spleen, resulting in hemolysis, which is the destruction of blood cells. Splenitis is inflammation of the spleen. And your word parts. A equals no, not, or without. Spleno is spleen. Ia is a condition. Hyper equals excessive. Ism is a condition. And itis equals inflammation. Systemic infections of the blood. Severe sepsis is an inflammatory response affecting the whole body caused by an infection, trauma, or ischemia. Septicemia is a systemic infection in the blood caused by pathogens that have spread from elsewhere in the body. Septic shock is the result of low blood pressure caused by overwhelming infection. Organ fail and then death may occur. Systemic inflammatory response syndrome is a type of septic shock characterized by an inflammatory state affecting the whole body. It may be caused by an infection, trauma, ischemias, or inflammation. Your word parts. Septiso is infection. Emia is blood condition. Septo also means infection. And ic equals pertaining to. Certain disorders involving the immune mechanism. Autoimmune lymphoproliferative syndrome, ALPS, is an inherited disorder of the immune system with unusually high numbers of lymphocytes that accumulate in the lymph nodes, liver, and spleen. Graft versus host disease is GVHD, is a disorder occurring when donate tissue cells attack the cells of the recipient. Hypogammaglobulinemias is a lack of antibodies, also known as hemoglobin G, in the blood. Sarcoidosis is an inflammatory disorder in which small flesh-like tumors develop throughout the body. And your word parts. Auto equals self. Immuno is safety protection. Syn equals together. Drome equals run. Hypo equals deficiency. Globulin O is protein. Emia is blood condition. Sarco is flesh. Oid equals like. And osis is abnormal condition. Other immune disorders. Acquired immunodeficiency syndrome, AIDS, is caused by the human immunodeficiency virus, HIV, which is transmitted through body fluids via sexual contact or intravenous exposure. HIV attacks the helper T cells, which causes a diminished immune response. The autoimmune disease is a condition in which a person's T cells attack his or her own cells, causing extensive tissue damage and or organ dysfunction. Examples of resilient autoimmune diseases include myasthenia gravis, rheumatoid arthritis, systemic lupus erythematosus, and multiple sclerosis. Your word parts would be immuno is safety and protection, and auto equals self. A review question. Which type of anemia is iron deficiency anemia? A. Pernicious anemia. B. Sideropenia. C. Aplastic anemia. Or D. Thalassemia. And it would be letter B. Sideropenia. Remember that cyto equals iron and penia equals deficiency. Another review question. What is a group of inherited bleeding disorders characterized by a deficiency of one of the factors necessary for the coagulation of blood? A. Purpura. B. Thrombocytopenia. C. Hemophilia. Or D. Polycythemia vera. And your answer here would be C. Hemophilia. Benign neoplasms. Myelodysplastic syndrome is a group of disorders that result from a defect in the bone marrow, also referred to as pre-leukemia. Polycythemia vera is a condition in which the bone marrow produces an excessive number of blood cells. The only type of benign neoplasm for the blood, lymphatic, and immune system is thymoma. This non-cancerous tumor is of epithelial origin and is often associated with myasthenia gravis. And your word parts. Mylio is bone marrow. Dis is abnormal. Plastic pertain to forming. Poly is many or much. Cyto equals cell. Hemia is blood condition. Vera equals true. Thymo is thymus. And oma is either tumor or mass. Acute lymphocytic leukemia, also abbreviated ALL, is also termed acute lymphoblastic leukemia. It is characterized by uncontrolled increase in the number of immature lymphocytes. It is the most common type of leukemia for individuals younger than 19 years of age. Note that the lymphocytes are a form of white blood cells. Acute myelogenous leukemia, AML, is a rapidly progressive form of leukemia that develops from immature bone marrow stem cells. Chronic lymphocytic leukemia, CLL, is a slowly progressing form of leukemia in which immature white blood cells are proliferated. This form is most frequently seen in the middle-aged or older patients, seldom in children. Chronic myelogenous leukemia is a slow-growing form of leukemia in which immature bone marrow cells proliferate. Like CLL, it occurs most frequently in middle-aged or older adults, rarely in children. And your word parts. Lympho is lymph. Cyto equals cell. Ic equals pertaining to. Leuko equals white. Emia is blood condition. Myelo is bone marrow. And genus is pertaining to the originating form. Hodgkin's lymphoma, also called Hodgkin's disease, is a cancer of the lymphatic system that is diagnosed by the detection of a type of cell specific only to this disorder, the Reed-Sternberg cells. Non-Hodgkin lymphoma is a collection of all other lymphatic cancers except for Hodgkin lymphoma. It is the most numerous of the two lymphomas and is the sixth most common type of cancer found in the United States. Multiple myelomas, also called plasma cell dyscrasia or myelomatosis, is a rare malignancy of the plasma cells formed from B lymphocytes. It is called multiple because the tumors are found in many bones. If it occurs in only one bone, the tumor is referred to as a plasmyxoma. A malignant thyoma, also called a thymic carcinoma, is a rare malignancy of the thymus gland that is particularly invasive, and unlike its benign form, it is not associated with autoimmune disorders. Note that these terms related to malignancy do not contain the suffixes carcinoma or sarcoma. And your word parts. Lympho equals lymph. Oma is tumor or mass. Myelo is bone marrow. And thymo is thymus. Review question. Which of the following is a cancer diagnosed by the presence of Reed-Sternberg cells? Your answer would be B, Hodgkin lymphoma. Laboratory tests. The AIDS tests, such as ELISA and their Western blot tests, are done to detect the presence of HIV types 1 and 2. The basic metabolic panel is a group of blood tests to measure calcium, glucose, electrolytes such as sodium, potassium, and chloride, creatinine, and blood urea nitrogen, also known as BUN, B-U-N. The comprehensive metabolic panel is a set of 14 blood tests that add protein and liver function tests to the BMP. Glucose is also measured with a different method than in the basic panel. Blood cultures are blood samples that are submitted to propagate microorganisms that may be present. Cultures may be indicated for bacteremia or septicemia, or to discover other pathogens such as fungi, viruses, and parasites. The complete blood cell count, also known as a CBC, is a set of 12 tests, including RBCs, which are red blood cell counts, WBCs, which are white blood cell counts, HB or HGB, or hemoglobin, HCT or PCV is hematocrit, packed cell volume, and differentiates the WBC differentials. A Combs antiglobulin test is a blood test to diagnose hemolytic disease of the newborn, HDN, acquired hemolytic anemias, or a transfusion reaction. A diff count is a measure of the number of different types of WBCs. An erythrocyte sedimentation rate is a measurement of the time it takes for mature red blood cells to settle out of a blood sample after an anticoagulant is added. An increased ESR may indicate an inflammation. Hematocrit, also called a packed cell volume, is a measure of the percentage of RBCs in the blood. Hemoglobin is an iron-containing pigment of RBCs that carries oxygen to the tissues. And your word parts, you got anti is against, globulin is protein substance, hemato equals blood, crit is separate, hemo is blood, and globin is protein substance. The mean corpuscular hemoglobin, the MCH, is a test to measure the average weight of hemoglobin per RBC. It is used in diagnosing anemia. A mean corpuscular hemoglobin concentration, also known as MCHC, test is done to measure the concentration of the hemoglobin in RBCs. The test is useful for measuring a patient's response to treatment for anemia. The partial thromboplastin time, also known as PTT, is a test of blood plasma to detect coagulation defects of the intrinsic system. It is used to detect hemophilias. The thrombin time, the PT, is a test that measures the amount of time taken for the clot formation. It is used to determine the causes of unexplained bleeding, to assess the levels of anticoagulation in patients taking warfarin or vitamin K deficiency, and to assess the ability of the liver to synthesize blood clotting proteins. A Schilling test is a nuclear medicine test to diagnose pernicious anemias and other metabolic disorders. A white blood cell count, the WBC, is a measurement of the number of leukocytes in the blood. An increase may indicate the presence of an infection. A decrease may be caused by radiation or chemotherapy. And the word parts, hemo is blood, globin is protein substance, thrombo is clot or clotting, plastin is a forming substance, pro is before, and thrombin is clotting substance. Blood and bone marrow procedures. The term apheresis means removal either as a suffix or as a standalone term. In regards to blood, it is the temporary removal of blood from a donor, the separation and removal of one or more components, and the reinfusion of the remaining blood bank back into the donor. Leukapheresis is the removal of white blood cells. Plasmapheresis is the removal of plasma. Plateletpheresis is the removal of platelets or thrombocytes. Blood transfusions are the intravenous transfer of blood from a donor to recipient. If an autologous transfusion, it is a process in which the donor's own blood is removed and stored for future use. If an autotransfusion, it is the process of transfusion the patient with his or her own blood from an active bleeding site in cases of major surgery, trauma, after anticoagulation, and filtering. And be careful not to confuse apheresis, which meaning removal of blood, with poiesis, which means formation. And then you've got your word parts. Apheresis is removal. Leuko is white. Plasma is plasma. Platelet, O is platelet. Auto equals self. Logio is study. Os is pertaining to. Trans equals across. Fusion equals pouring. Hemo equals blood. And stasis is stopping or controlling. Blood and bone marrow procedures. Another one is a bone marrow transplant. That's the removal of healthy bone marrow from either the patient or a donor for later transplantation. An autologous transplant, auto means self, is bone marrow tissue taken from the patient before treatment to be reintroduced later to form healthy blood cells. A homologous transplant, homo means same, is a transplantation of healthy bone marrow from a donor to a recipient to stimulate the formation of new blood cells. Lymphatic and immune system interventions. An adenoidectomy is the removal of the pharyngeal tonsils, the adenoids. Biopsies of lymphatic structures are removal of the lymph nodes or lymphatic tissue as a means of diagnosis and treatment. A lymphadenectomy is the removal of a lymph node, the same as a lymph gland. A splenectomy is the removal of the spleen. And then your word parts. Adenoid is adenoid. Ectomy is cutting out. Bio is life. Opsy is viewing. Lymphato is lymph. Ic pertain to. Lymphadeno is lymph gland. Or spleno is spleen. Review question. Which of the following can be used as a suffix or a standalone term to mean removal? A. Apheresis. B. Poiesis. C. Fusion. Or D. Apheresis. And your answer here will be A. Apheresis. Okay, your pharmacology immune drugs. You got your anticoagulants, which prevent or delay the coagulation of blood and the formation of thrombi. Antifibrinolytics stops bleeding by blocking plasmin formation. Antiplatelets inhibit the function of platelets or destroy them. Blood flow monitors promote blood flow by keeping platelets from clumping or decreasing blood viscosity. Colony stimulating factors, CSFs, stimulate the production of white blood cells in the bone marrow. Erythropoietic agents increase production of RBCs by stimulating erythropoiesis. The hematinics increase the number of erythrocytes and or hemoglobin concentration in the erythrocytes, usually to treat iron deficiency anemias. Hematopoietic agents stimulate blood cell production. Subdivisions of this class could include colony stimulating factors, erythropoietic agents, and thrombopoietic factors. Your thrombopoietic factors stimulate the production of thrombocytes and platelets. The antineoplastics treat cancer by prevent growth or promoting destruction of tumor cells. Antiretrovirals minimize the replication of HIV and its progression into AIDS. Corticosteroids are steroids that suppress the immune system and reduce inflammation. Cytotoxic agents damage or destroy cells to treat cancer, often act as an immunosuppressant or the antineoplastics. Immunomodulators reduce the impact of immune system disorders. The immunosuppressants minimize the immune response. Protease inhibitors are antiretrovirals used to treat HIV infection by blocking the production of an essential enzyme called protease. These drugs keep the virus from replicating. Vaccines are modified disease, causing microbial components administered to induce immunity or reduce the pathological effects of a disease. A vaccination is an injection or oral solution derived from dead or weakened virus. Note that you may have heard the terms vaccination and immunization used interchangeably. A vaccine is the substance that produces immunity from a given disease. It can be introduced into the body orally, intranasally, or by injection using a needle, usually intramuscular. A vaccination is the introduction itself, and immunization is the entire process of providing protection. There are not many suffixes that relate to root operations for this chapter, but the one that is ectomy, which means excision and resection. So sort these terms into the correct categories. So your categories A and P, anatomy and pathology. pathology and procedures. So which would be the AP? That would be the phagocytosis. Pathology is thalassaemias, and procedures is hematocrit and apheresis. And this concludes the lecture for blood-forming diseases.